Hey there, this video is for all of you that have hip or knee pain. I'm going to show you some of my favorite stretches that you can do. I'm also going to give you a couple other interventions that you can do right in the comfort of your own home in order to really help to manage or to gain some relief. So if you're experiencing what's called IT band syndrome, or maybe you don't even know what that is. So if you're having pain, like a lot of people will have pain on the outside of their hip that runs all the way down to the knee. This is called the IT band. The IT band then comes and it inserts into the kneecap and also comes down to the outside of the knee. So this is running on the lateral side of the thigh and can cause a great deal. I actually have this issue. A lot of runners will have some tightness in their IT bands that really will benefit from this. So first and foremost, it's important that when you do have IT band syndrome, you need to make sure a few things. That one, your pelvis is in good alignment. That will, otherwise it'll be hard to fully recover from it. So, but if you have good alignment of your pelvis, these are my favorite stretches. You will need, it's hard to see with my black shirt, but you will need 2 yoga straps. I think 2 yoga straps at home, along with this little tool is called a gauchois. It's a Chinese jade scraper, a gauchois, G-A-U-S-H-A, like 17 bucks off of Amazon, is amazing. So you can just take this along the length of your IT band or any place that's really given you any type of discomfort, and it's going to give you some myofascial relief. So this is basically one great big band of connective tissue, and when it gets tight, it can cause just a great deal of stiffness, but more than anything, it can pull the knee joint out of alignment. It can cause the patella to track laterally, so it can really cause a lot of issues. All right, so I'm going to show you how to do these stretches. So first of all, with a long strap, I always say if you're going to buy these, get an 8-foot strap. And you're going to make a big loop in it. These are just yoga straps. So a big loop, a longer loop if you've got longer legs. I do not. And then you're going to lie down. So the strap is going to go on one foot and then the opposite hip. So you'll be just like this. And so the first stretch that you're going to want to do, make sure your shoulders are down and back, and you're just going to draw your knee up and in. Now, why the strap? The strap is actually going to help to give your hip joint some space. So oftentimes what happens when we're stretching tight muscles in our legs is that we then accommodate through our spine. We lose that spinal neutral position, and we really don't get the stretch to occur where we're aiming for it, because our bodies always take the path of least resistance. So it will go, if you've got a tight muscle, it's because that muscle is pretty strong, and there's usually a muscle imbalance there. So the opposite muscle to that is typically a little bit longer and weaker. So that's where the strap helps to just really isolate. So the first one is just a knee to chest. I always, rather than counting, I always just count my breaths. So I want to make sure that I hold for at least 5 breaths. That's what gives me the most benefit. The next, I've got my second strap, which you don't have to have a second strap. For me, we have lots of straps here at the center. So anyhow, here we're going to do a hamstring stretch. And as see, I'm also getting into my calf muscles as well by drawing the toes back toward my head. So that is really helping with this strap here. It's not only giving my hip a downward glide, so it's almost like a manual therapy technique that we do, but it's really helping to isolate my hamstring. And then you rotate your toes. So you're rotating your toes, the upper toes, toward your opposite hip. You'll take the strap into the opposite hand, and you're gonna take that across the body. Now this is what is key, because this is really getting into that lateral fascial plane that runs all the way down the leg. So really making sure that you're rotating that toe, the toes, so that they're pointing toward the opposite hip. If you're able to just bring this all the way across, and you notice too, my pelvis isn't moving. That is only occurring at my hip joint. And then the last one is that you, so we've got two more. You rotate the toes out to the side and take that out. So here I rotate my toes out to the right and I take it out to the side. And then lastly, you're gonna lift up, bend at the knee. The right hand will come behind the right knee. The left hand will come onto the ankle. Now here, make sure that you're not rotating. This isn't a rotation through the knee. This is coming through the hip itself and just drawing that up and in. And those are my favorite stretches. Always, always do them on both sides, so that way you make sure, because what's funny is sometimes even though you're having pain on one side, it can honestly be due to the tightness that's occurring on the opposite side. So you may be longer, weaker on that side, shorter, tighter, so it's creating a pelvic rotation there. But those are really my favorite stretches to help with knee, hip. I even do it for pelvic alignment as well. That will give you a lot of relief. Don't forget your gauchois. And then also foam rolling is heaven. So you can use a foam roller up and down the outside, all the way from the hip to the knee, to really give that fascial plane some relief as well. Right, see you all next time.